Do you have sciatica, but you're not really sure if it's sciatica or something else? Well, in this video, I'm gonna go through 3 tests that you can do that you're gonna determine whether or not you have sciatica, and then 3 things that you can do at home to start relieving it. I'm Dr. Matthew Posa. Welcome to my page. My page is dedicated to people and families with health tips and tricks so you can live the life you were designed to live. So don't forget to like, subscribe, and share this information with the people we know need it the most. Here are the 3 tests. So the first test that you're gonna do is the bend over test. And really what we're trying to see is whether or not you're getting the same pain. So you're gonna turn to the side, you're gonna bring yourself down, you're gonna be rounding your low back and stretching, just trying to touch your hands to your toes. As you do that, if you're getting a shooting pain, a worsening of the symptoms, then that could be a sign that you have sciatica. But it's also a sign that you could also just have tight hamstrings or any of the low back misalignment stuff. So then the next test that you're gonna do is you're gonna sit down and you're gonna do a leg crossover. The leg crossover is very simple. You're gonna bring the one leg over and see if you can do a figure 4. You're gonna bring the other leg over and see if you can do that. If at any point, let's say you have a problem on the left leg, that's where you're feeling a lot of the pain, the sciatic type of stuff, and you bring that over this way and you're noticing there's a ton of pain by doing this, or you can't even do it, or you're struggling to even do that, that's a sign that you have nerve tension, and that could be sciatica as well. The last test though is really gonna be the one that's gonna tell us. So as you sit back in a chair, on the bed, anywhere, on the couch, what you wanna do is kick out the one leg and then bend your chin to your chest. You're gonna hold that position. If you're getting an increase in that pain, shooting pain, burning pain, numbness and tingling down to your toes, into your feet, then that is a sign that you have nerve pressure, and therefore you're gonna wanna do these 3 next things in order to start relieving it. What you wanna do is called the bear position. The bear position is gonna relieve pressure off the low back, but it's also gonna start relieving pressure off the nerve by strengthening your core. So you're gonna go into an all 4 position. You're going to strengthen, so you're gonna hold the middle of your back, squeeze through your core as you lift your knees off the ground. Hold that for a few seconds and then bring it back. You're gonna repeat that 10 times. And again, holding for a few seconds in between. So bringing it up, hold for a few seconds, and then letting it go. The key there is to make sure that your core is tight. But the next exercise is called a nerve floss. The nerve floss is pretty simple. It's kind of like the assessment that we did earlier. So what you wanna do is bring your toe up, but this time you're gonna bring your head up, and then you can bring it down and back up and down. So when you're doing this, you're bringing up, looking up. So you're bringing your foot up and looking up. Now, as you do this, you're holding that for 3 seconds. You're gonna feel that. You're gonna feel the nerve stretching, but this is gonna bring more blood flow. It's gonna stretch out the nerve and decompress your spine and the nerve. So again, up like this, holding for a few seconds and letting go, and you can repeat that about 10 times. That will trigger a little bit, because if the nerve is irritated, it will trigger some of that, but over time, you're gonna start to notice that you're gonna get a lot more feeling, a lot more flexibility, and you're just gonna feel a lot better. Alternatively, if you can't do the nerve floss sitting down, then you can do it on your back. It's the exact same motion. What you're gonna do is lay on your back, affected leg is gonna come up. I would brace it with the hands, and all you're gonna do is as your foot comes up, you're gonna extend your head back. So the motion's gonna look like this, and then back down. Again, you're gonna repeat this 10 times. You will sometimes get the feeling, that nerve feeling, but that's a good thing because we're flossing the nerve. The last exercise that we're gonna do, or stretch, is the lumbar decompressions. Because of the low back is where the nerves that form the sciatica come out of, we're gonna make sure that the low back is clear and that there's no pressure on the nerve. So all you're gonna do is you're gonna lay on your tummy in your bed, or you could do it anywhere on the ground, and all you're gonna do is lift your torso up and extend your back. Hold this for a few seconds and then bring yourself back down. You're gonna do that as best that you can. So if you can't get all the way up, then don't go all the way up. You can start over here. Some people even use pillows. There's so many different ways of doing this, but what you wanna do is get to this point where you can fully extend your back. You're looking up, and then you're bringing yourself back down. Again, you're holding that for only a few seconds. There's a ton of different reasons why people get any types of problems with the nerves in the low back pain, hamstring issues, pelvic issues, sciatica. So if this is you, the one thing, and if any of these tests are proving to you that you do have that nerve irritation, you do have that nerve tension, and you do have the sciatica, or if it doesn't, so let's say you do all this stuff and you're noticing that this isn't the problem, I'm not getting a reoccurrence, I'm getting a different type of tension, it isn't going all the way into my foot, or that you're just getting pain in a very local area, then a lot of times that's a muscle issue. One of my best recommendations that I can give you is to get to a chiropractor, get to a corrective care chiropractor, because it's not only assessing the spine to make sure that this is in coherence and everything is balanced and leveled out and that there's no nerve irritation, but the role of the chiropractor is to determine what's the best course of action, whether or not you need a surgery, whether or not you need to go see your GP. We are the first point of contact and the experts when it comes to this kind of stuff. Thank you for watching. Don't forget to like, subscribe, and share this information with the people we know need it the most. If you have a question or a comment, you can leave it down below. Until next time, we'll talk to you soon.